Hello, welcome to Telesur. I'm Carla Gonzalez, and this is Interviews from Quito, the program where we explore the big challenges facing this country and the region. In today's program, we will look at the spread of the coronavirus around the world, a new virus that has killed hundreds in China and infected thousands around the world. We want to look at where it comes from, how we can protect ourselves, and how we can stay away from spreading false news and xenophobia. For that, we have Dr. Esteban Ortiz, researcher and professor at UDLA University here in Quito. So let's look at this video first.
The coronavirus has put the whole world on alert. In China, there are already more than 24,000 people infected and 490 fatal cases confirmed. It has also spread to 25 countries around the world. The World Health Organization talked about the ways to prevent the contagion of this virus, but the speed with which this virus keeps moving from one person to another is still alarming. In Ecuador, a Chinese patient was hospitalized in a critical condition to be sure if he's infected with this virus, but the health minister has already confirmed that he's not. What can we expect from this in the near future? Follow our analysis.
So thank you for joining us, Dr. Ortiz. First, let's look at the coronavirus. What is it? What are the symptoms? Let's understand a bit more about what this is.
Okay, sure. Thank you very much for this invitation. So pretty much this is a type of zoonosis. We call it like that. It's pretty much a disease that is usually found among animals. And in this case, this type of virus that already causes infections in humans have mutated in the last, decade or 2 decades 3 times with the coronavirus. So this virus pretty much is affecting the people in China because it did a viral jump, something that we call in epidemiology when a virus is affecting animals, and suddenly the human become a reservoir. So pretty much this new virus is not new for animals, and this viral jump is pretty much well known for humans. In the last thousands of years, we have many of those cases, including Ebola, HIV, and some other diseases.
And how does it go through from an animal to the human, and from which animal does it pass through?
The information is still scarce. We are struggling to get real information at this point. It's been amazing the speed of the information that is being published in the last month and a half, but we assume that it's coming from either a bat, a snake, or a type of bird. Anyways, more than 20 species of animals have been identified that share the same genetic material than the coronavirus. So we speculate that it can come from any of those animals, but it's likely that it comes from a bat at this point.
And what are the symptoms when it passes, it makes that jump onto humans? How does it affect humans?
It depends on the population. If you are one of those categories of vulnerable population, like small kids, sick people, older people, or people with chronic diseases, you might get more severe symptoms, but pretty much entitled respiratory symptoms. It could be from a mild flu type of flu disease, like headache, fever, and pretty much it could stop there, or can continue to an atypical pneumonia that is complicated. And if this atypical pneumonia gets complicated, it can become SARS, which is severe acute respiratory syndrome, that we call it in the hospital. So it's pretty much a very severe pneumonia that blocks pretty much the entrance of air in both lungs.
And there has been a lot of talks about this SARS, the respiratory syndrome. What is the difference between both? Because there's a lot of comparison, because in China it killed a lot of people a couple of years ago, but now it's different. Can you explain a bit that difference? Yes, of course.
So SARS, it made public appearance in 2002 because of this new coronavirus at that time, causing this type of really contagious and really severe pneumonia that at that time it didn't have a name, so they call it SARS. So the type of coronavirus that in 2002 caused this type of pneumonia was identified as SARS. But SARS could be an entire clinical entity that encompasses several signs and symptoms. So SARS can happen with this new type of coronavirus as well. And if you have an atypical coronavirus infection or a severe viral infection like the patient that we have in Quito right now, which was caused by a different etiological agent, is still SARS, because the patient developed SARS, which is pretty much a severe respiratory syndrome that was not related with coronavirus, but it's pretty much, that's the difference. So coronavirus could be the virus per se, or could be the entire clinical presentation of SARS.
So you mentioned this patient that arrived to Quito, and there was a lot of misinformation, a lot of people saying that he did have coronavirus, a lot of fake news around his case, and a lot also lack of information from the government and from the health authorities. What happened with that case?
Yes, I mean, it was pretty painful to kind of like to observe how the higher authority in the public health system in Ecuador didn't have enough information at the right time. So pretty much we were struggling to understand if the patient that arrived from China maybe 15 or 16 days ago had coronavirus or not. So we failed in getting the diagnosis as soon as possible, as is recommended by the World Health Organization. So pretty much we failed in the diagnosis, and I think we failed in sharing accurate information. So all of the community, the entire community, physicians, politicians, and social media, and all of these TV and radio media were talking about a spread of a virus, an epidemic that we didn't know if was actually an epidemic. So at this point, I will say that hopefully we have learned the process of training better our health authorities in sharing this type of information, so the community can rely on them. Because at this point, I think there is a sort of bad feelings against the higher authorities, so we don't trust them very much at this point. And this is because miscommunication happened since the beginning of this epidemic.
And now there's also a patient in Riobamba. There's also talks about the people who traveled with this patient, this Chinese person that arrived to Quito, and there's no information on how they are doing. Are they infected? Are they not? Do they not have the virus? It's a lot of misinformation there.
Yes, because of the patient came in a commercial flight, pretty much most of the passengers were suspected cases, as the higher authority of public health reported. I am aware that they have followed them, they have tracked them, and the last report that I saw about those patients, they are all clinically okay. Nobody's doing any type of, or nobody's presenting any sign or symptom that could be related with coronavirus. So at this point, if the coronavirus suspected case was pretty much confirmed as negative, we can assume that those patients can be released from their epidemiological, pretty much like enclosure, as we call it, right?
And what happens when a person is suspected of having a coronavirus? What is the process that it follows? The quarantine process, how is that process? At least most people in Ecuador are not very familiar with this type of procedures.
Yes, totally. And I think the first thing is we have to make a small difference between Ecuador and probably Latin America and the rest of the world, because we don't have that amount of resources, so it becomes a little more challenging for us. But when you get this type of epidemics, you need to describe what is a case. And the Minister of Public Health in Ecuador, they describe a case as any passenger that came from China and developed respiratory signs. But also they describe as a suspected case all of the medical personnel that treated that patient. So in that, using that description, pretty much every doctor that was with the patient could be suspected case, right? So how we deal with those? In the first time, what we have to do is track them, try to make the diagnosis as soon as possible. I mean, that's something that we really need to do. Like every patient that is suspected, we need to collect a sample that can be identified or can be like sequenced using real-time PCR, that is the technology, and try to get the diagnosis as soon as possible.
But can that be done in Ecuador? Because we saw reports of the president of Ecuador saying that this person that had arrived to Quito, the sample was sent to Canada, to the United States. There were a couple of misinformations there, and we still don't know if it took that long to get to the actual information.
Yes, I mean, I think everything started with the miscommunication, because this is a new virus, so it's understandable that any country will have the primer, as we call it. So this primer is part of the diagnosis for this type of diseases. So we didn't have the primer at the time, but when the epidemic started, I suggested the Minister of Public Health that they should start getting these primers. So we didn't get those on time, so the sample was sent to the CDC in Atlanta, in the US, and to Canada. But at this point, I read from different sources that the primers are here in Ecuador now. So now we should be able to get the diagnosis through the INSPI laboratory, which is the national reference laboratory, but also the universities. We, at the UDLA University and some other universities in Quito and in Guayaquil, we have the capabilities to perform this type of analysis if we already have the primer. So it should be possible.
Now that we are really talking about this virus and the spread that it has killed, hundreds and tens of thousands already have the virus in China and other countries around the world. How can we in Ecuador prevent this virus from reaching?
So the first thing is, like, I will suggest the people to remain calm. The World Health Organization Maximum Authority, they released this statement with 7 points that we have to follow, and one of those is like, keep calm, do not stop human mobility. Is not mandatory to close borders at this point, but I will say, like, remain vigilant, try to control either airports, ports, or walking frontiers like the ones that we have in the south and in the north, and try to increase the resources that are destinated to the public health system. So now, for us, it's a good, kind of like a good thing that this coronavirus happened, because the government can put the eyes on us and say, like, hey, public health is needed, we need more resources, instead of putting more people, laying down people, and pretty much getting smaller the amount of doctors that work for the public system. We can actually get more people, train people, and maybe obtain these thermometers that are placed in airports, so they can track people with higher temperature. I know it could be misunderstood for many other people that is not sick, but maybe they have higher temperature, maybe they were running or something, but at least it's a good screening process, so I can track those patients with higher temperature, to take them to go to maybe to the clinic at the airport and make a small clinical inspection and try to find out more information. And if they are not suspected or suspicious, they can just go home and go to their destination. But at least we do as a strict and very strong epidemiological surveillance process with these patients that arrive. I have to say that the epidemiological curve, in my understanding and according to some models that we already developed at the university, we estimate that it can increase at least until maybe June or July, because if we compare it with the SARS, the information that is available, at this point we already surpassed the number of cases, and we assume that we are going to see fewer cases maybe at the beginning of the summer. So we are positive that we might reach at least 100,000 cases in the world, at least at that time. And this is just my personal appreciation through some data that we have modeled, but of course it's just prediction models. We cannot assure anything, right?
So we're talking maybe a epidemic, a pandemic. What's the difference between those words to understand the virus?
Yes, so usually like an epidemic could be like any amount of cases that were not expected for a different population. So if we have here some disease that usually occur in Ecuador, we expect the similar numbers of cases that happen every year. But if one day we develop like 2,000 or 3,000 more cases than expected, we can call it an epidemic. If this epidemic leaves the country and start affecting other countries, we can start calling it a pandemic. Anyhow, it's kind of like a black hole in the definition of pandemic or epidemic, because at this point more than 25 countries have positive cases, and still is an epidemic. It's not a pandemic yet. Why? Because most of the cases are recruited in China. 99% of the cases are in China at this point. So it's pretty much managed as an epidemic. There's another definition for epidemic. If you have a really severe case, could be one, for example, for chicken pox, or maybe could be one case of Ebola, it could be an epidemic already. So we start the alarms for this type of cases. In this time, I will say it might reach the pandemic definition maybe in a couple of months if we cannot control those cases inside China. So this is pretty much the difference. The pandemic, it will affect more countries and it will spread like more rapidly through the borders.
Now, the cases of virus, for example, in the United States or in other countries, if we compare them, they can be a lot stronger. For example, the last year in the United States, more than 10,000 people died of the flu, according to some researchers. So why are we not saying, let's be careful of the flu that we can get if we travel to Miami or New York, but we are talking about being careful of obtaining a virus if we go to China?
I mean, this is, I will assume the reason goes along the fact that now everything is related to social media and media. So, of course, a new virus will get a lot of attention. And as I told you before, I'm pretty happy this happened, because we can actually use the momentum to put on, this type of screens and this type of spaces, all of the diseases that are actually more dangerous than this type of coronavirus. In Ecuador, we have like 20 people dying every day for heart diseases. So who is taking care of those patients? Who is running, or who you are not seeing in the news or in the local newspapers, prevention measures to reduce obesity, or you're still seeing other type of advertisement that could be, encouraging people to eat bad food. So I will say, like, this depends on fashion. Like at this time, all of these new stuff is driving the world crazy, and that will be one of the main reasons. But yeah, as you said before, the flu in Ecuador also killed more people than the coronavirus, and in the US, as you said before, like thousands of people die. But we have to make sure that people understand that the mortality rate for flu or for the influenza type of virus is way lower than for coronavirus. Is around 0.1% of the cases will die, and for SARS in 2002 the mortality reached 10%. The MERS in 2012 reached 13% almost. And with the coronavirus, we don't have the entire set of data because this epidemic is growing, but at least the proportion of cases and the proportion of people who had died, it reached 2% at most. So it's not that lethal as other coronavirus, MERS or SARS, but it's definitely more lethal at this point than the normal flu.
And that also adds to a little bit of xenophobia, right? A lot of people that are saying, well, don't get close to Chinese citizens because Chinese people bring the flu in a very xenophobic way.
Yeah, that's definitely something that we are trying to avoid and prevent through this type of communication, and this is a good space to do it. Not every people with the eyes, kind of, we call it like, kind of like, I don't know how you explain the type of eye that is, we call it rasgados, like this type of eyes. Not every people are from China, and not every people from China has the disease. And no stigma, no fear, and no miscommunication was recommended by the World Health Organization. So the people that is watching us right now needs to be aware that this type of disease can affect every other community in the world. So it's not a Chinese problem at this point. Yes, it started in China because the conditions or the habitat and like were kind of through facilitating the viral jump, but this can happen at any time. South America, especially the countries that have Amazonia region, we are at higher risk of having this viral jump. So today, are people from China, maybe in 10 years, it might be a virus that started in Ecuador, and we don't want people discriminate us or treated as different because this virus started in our country, right?
Exactly. That's why it's important to have communication, to have information and education also in these cases. Thank you very much, Esteban, for your time.
You're welcome. Thank you very much.
We've been talking to Dr. Esteban Ortiz, university researcher and professor at UTLA, about the outbreak of the new coronavirus, debunking some myths, and learning how to prevent more infections. Thank you for watching Interviews from Quito. I'm Carla Gonzalez. Until next time.